Ethics44 Lawsuits Against Doctors. To understand medical malpractice for the USMLE, you must master the 4 Ds of negligence. If any one of these elements is missing, a medical malpractice lawsuit generally will not hold up. The 4 Ds of negligence. 1. Duty. A physician-patient relationship must be established. 2. Dereliction. The physician deviated from the standard of care, meaning they acted in a way that a reasonably prudent physician would not. 3. Direct causation. The physician's breach of duty was the direct cause of the patient's injury. 4. Damages. The patient suffered actual harm, whether physical, financial, or emotional. Case 1. Malpractice. The successful lawsuit. A 25-year-old patient presents with severe right lower quadrant pain and fever. The emergency physician assumes it is gastroenteritis without performing a thorough abdominal exam and discharges the patient. That night, the patient's appendix ruptures, leading to septic shock and emergency surgery. Why it's malpractice? The physician had a duty, breached the standard of care, dereliction, by missing a classic appendicitis presentation, and this error directly caused the injury, causation, and the resulting hospitalization and suffering, damages. Case 2. No malpractice, bad outcome without negligence. A patient undergoes knee replacement surgery. The surgeon explains all risks, including infection, and obtains informed consent. The surgery is performed perfectly according to the standard of care, but the patient develops an infection afterward. Why it's not malpractice? A bad outcome does not equal negligence. The surgeon met the standard of care, and the infection was a known complication. Since there was no dereliction, the physician is not liable. Case 3. No malpractice, error without damages. A physician prescribes the wrong medication for a patient's hypertension, which would have caused a dangerous interaction. However, the pharmacist catches the error, calls the office, and the physician corrects the prescription before the patient ever takes the medication. Why it's not malpractice? Even though the physician committed dereliction by prescribing the wrong drug, the patient suffered no actual harm, damages. Without damages, a malpractice suit cannot proceed. Case 4. No malpractice, Good Samaritan/no duty. You are at a party when a stranger collapses. You act as a volunteer physician to perform CPR, but during the process, you accidentally break one of the patient's ribs. The patient attempts to sue you for the injury. Why it's not malpractice? In many jurisdictions, Good Samaritan laws protect physicians who volunteer in emergency situations outside of the clinic. Furthermore, Because there was no established physician-patient relationship, duty, the standard of care for a clinic setting does not apply.